Today we're going to talk about ear infections in children. Ear infections, one of the most common reasons for a little child to be miserable and for a parent to be sleep deprived. Approximately 25% of infants at least have had one ear infection by their first birthday. These infections can cause pain in the ear, fever, and potentially hearing loss and general signs such as loss of appetite and irritability. Some children might get better with that specific antibiotic treatment, but most young infants benefit from the use of an antibiotic. But what is an ear infection? An ear infection is also known as an acute otitis media, which is a fancy expression to say that the middle portion of the ear is infected. Most of the time, it is caused by bacteria that nearly all children have in their nose and throat. These infections most often develop after a viral respiratory tract infection, like a cold or the flu. These infections can cause swelling inside the nose, the throat, and even the ear. And that reduces the clearance of bacteria from these areas, making it easier to get an infection later on, and an infection that would affect the middle portion of the ear. And that is because they impair the Eustachian tube functioning. The Eustachian tube is a tiny little structure in the middle ear that works to balance the pressure between the middle ear and the outside. And that is because the middle ear is embedded into the bone. So you need to balance that pressure. When you have the congestion associated with cold or the flu, that tiny little structure gets clogged up, and then the pressure builds up. When that pressure builds up and the middle ear is not draining, it's easier for this bacteria to cause an infection, and there is also a collection of fluid in the ear canal. What are the symptoms of an ear infection or an acute otitis media? Symptoms of an ear infection in adolescents and older children may usually include pain or aching and sometimes a little bit of a hearing loss, like a muffled sound. In infants and young children, symptoms of an ear infection might not be specific. Many of those can be caused by a viral infection at the same time. But the symptoms in general of an ear infection can include the following: fever, temperature 100.4 or higher, pulling of the ear, being fussy, irritable, or restless, having difficulties with the sleep, decreased activity, lack of appetite or difficulty eating. Sometimes they can have vomiting or diarrhea, but that is not because it is affecting the ear and is causing the diarrhea directly, but because overall they are sick. Also, draining of fluid from the outer ear. How do we make the diagnosis of an ear infection? The examination is not painful, but most infants and children do not like having the ears examined. Sometimes to make it easier, you can hold your child on your lap and hug gently your child while the doctor actually uses an instrument called an otoscope to look inside the ear. Sometimes we have to remove some of the wax to be able to look at the eardrum. So basically, we determine that the child has an infection when the eardrum, that tiny little translucent membrane that we have in the middle ear, has some features suggestive of an infection, like redness, bulging, and a fluid level. How do we treat an ear infection? Treatment of an ear infection can include the use of antibiotics, medicines to treat the pain and the fever so that the child is more comfortable, observation, which we call often watchful waiting. In any case, the treatment should be individualized based on your child's age. It's not the same thing to have a 2-year-old to have a 15-month-old child. The history of previous infections, how severe the infection is, and underlying conditions. Antibiotics are routinely given to infants who are younger than 24 months or who have high fever or infection in both ears. With children who are older than 24 months and have mild symptoms, they may be treated with an antibiotic, or often they could be observed to see if they improve quickly without antibiotics. So that's not unusual to do. Observation of those children could be recommended in this particular situations. If your child is older than 24 months, if ear pain and fever are not severe, if your child is otherwise healthy and acting normally, pain-relieving medication should be given to reduce the pain, whether your child is receiving antibiotics or being observed. It is uncomfortable. If your child is being observed rather than treated with antibiotics, you need to call or go back to the doctor after 24 hours for follow-up. If your child continues to have fever or the pain worsens, then probably you need to have additional treatment. Your child's symptoms should improve within 24 to 48 hours, whether or not antibiotics are prescribed. If your child does not improve after 48 hours or gets worse at any point, you need to call your doctor for further treatment and evaluation. An ear infection can be complicated, and these are some of the complications that can happen. The eardrum, which is called the tympanic membrane, can break. One of the most common complications that can happen. The tympanic membrane or the eardrum can rupture, can break when the fluid increases the pressure in the middle ear and reduces the blood flow, causing the tissue of the eardrum to break. Hearing loss is another very concerning potential complication of an ear infection. Because the eardrum is so important for the transmission of sound, if it breaks, it can actually harm the hearing process for the child. And that eventually can interfere with learning or the speech of the child. Is there any way that we can prevent an ear infection? Actually, yes. Some children develop ear infections quite frequently, and recurrent ear infections, which is defined as 3 or more infections in 6 months or 4 or more infections within 12 months, can actually be prevented. In addition to receiving the regular vaccinations that every child should be receiving and also the influenza vaccine every season, several interventions can reduce the risk of recurrent infections. Some of these interventions include not smoking around your child. Breastfeeding is great to reduce that. And in some cases, the use of antibiotics continuously at a low dose. And finally, the use of tubes, tympanostomy tubes or ear tubes. So to summarize, these are the 5 things I would like for you to remember regarding ear infections or otitis media. Otitis media refers to the infection in the middle ear. They happen because the Eustachian tube, that tiny little tube in the middle ear, doesn't work properly. In children less than 24 months, always you get antibiotics. 4, on children older than 2 years old, it is not always necessary to have antibiotics, and a watchful observation can be done. And finally, recurrent ear infections may lead to hearing issues.